Some troubling news now for many folks who snore. We're learning they could actually have a higher risk of cancer. Scientists say they found a possible link between cancerous tumors and sleep apnea, the common disorder that disrupts your breathing and often leads to the snoring. The researchers say that sleep apnea can deprive your blood of oxygen it needs, and that could bring on the tumors. One University of Wisconsin study shows that patients with severe sleep apnea are 5 times more likely to die of any type of cancer compared to folks who breathe normally when they sleep. With us now, Dr. Richard Fershine. He's a family physician and medical director at the Fershine Center for Comprehensive Medicine right here in New York City. Snoring brings on tumors. It just sounds so hocus pocus.
Right, and here's something that we all have seen or we've heard about it. Friends or family members complain of somebody who snores, and we kind of laugh it off. It turns out from these 2 studies, and these are the kinds of studies that doctors and scientists and researchers love. 20-year follow-through study at the University of Wisconsin, a 7-year Spanish study. Both of them show that there was a significant increase in the risk of cancer for people that snore and have sleep apnea.
All right, so people who are just now freaking out because their partners or their spouse have been mad at them for years because they snore all night. Now they worry about cancer. What do they do?
Well, the first thing to do is to talk to your doctor and figure out what you can do to make the proper diagnosis. From this study, what they found is that those individuals with the lowest oxygen levels, that's below 90%, they're the ones that had that 5 times increase in the risk of developing cancer. So the first thing to do is find out if you're in that group. And there are simple studies that can be done. There's an oximetry study that can be done at home that actually tests how much oxygen you have in your blood overnight. Another study can be done at a sleep disorder center. But there are a couple of things that people need to think about, because a lot of people don't know that they have sleep apnea, and they don't know that they have a problem. If you have daytime drowsiness, you can fall asleep in a moment. That's one indicator that you may have sleep apnea. So fatigue is a big issue. Snoring is another.
Fatigue and snoring, because all of this is about oxygen deprivation, everything.
Right. And what's fascinating about this is what they've found is that low oxygen levels are linked to cancer because it promotes something called angiogenesis. That's the process by where blood vessels from tumors actually grow. And they spread out through the tumors, they allow the tumor to spread throughout the body. So low oxygen levels appear to have that adverse effect and lead to this increase.
And people with low blood pressure are especially susceptible as well, right?
Well, low blood pressure is a big problem. Think about all the people that suffer with allergies, have congestion in their sinuses. There are some simple things then that we like to do. And in my office, and in offices that treat this problem, we recommend a number of simple techniques that you should try. 1, lose weight. It's a big problem. People with even a large neck, it's a way to actually make a circumference measurement, 16.5, 17-inch necks, have a much bigger propensity for having sleep apnea. Make sure when you're looking at your own particular situation, make sure that you're cutting down the amount of carbohydrates that you consume, because carbohydrates produce excess carbon dioxide that has to be blown out of your
sleep in
system.
an oxygen bubble, like Michael Jackson. I think it would be fun.
Well, listen, sinus sprays, and don't think that we're not going to recommend oxygen for a lot of people too.
Okay.
Simple things that people can do. Lie on your side when you're sleeping. That's one way to help yourself. Make sure that you get enough oxygen. Cut down on the amount of alcohol you consume. Cut down on smoking. Big stuff. It makes a big difference.
Not fun though. We're not going to do this.
Thank you so much.
All right. Day 2 of training for Facebook.